Welcome back to video number 4 of the PEMF training, pulse electromagnetic field therapy in a high intensity form. Now in this video we will discuss certain diseases, certain conditions, health conditions, how they are related to PEMF and what actually happens during those treatments in your body. And we look at different systems. As you know, we look at bone health, osteoporosis, tendon, joints. We look at muscular problems, nervous system, cardiovascular, lymphatic system, pretty much the whole lot. And PEMF will have an effect on all of them. Now, one of the key elements that I described in the first 2 videos is the increase in ATP, energy. And they could test that in regards to plant growth, where they used the same soil, the same type of beans, and they put them into soil. One was used with a very good fertilizer, and the other one had PEMF treatment. And the growth of the stem, the strength of the stem, the strength of the leaves was so much more powerful and better and stronger in the PEMF treated plant. And they could measure the ATP increase due to that experiment. So also the plant lasted much longer, had better fruit. And that is something that we try to prove in humans too. Now in this case, it was a patient with papillomavirus. And when you look at the Schiller test that was done, the glycogen content that is required for ATP production was extremely low. And you remember when I said you have low energy in the cells, that's when your cells cannot build that protective shield against viral bacterial infections. Well, papillomavirus is one of those. So as soon as you increase your energy level within the cell, you increase the ATP levels in the cell, you all of a sudden build that protective shield. And this patient here, after 2 months, there was no sign of the disease. You know that there is no treatment. It's an incurable infection that you have for life. And that means when you start building up your ATP, you start building up your enzyme protection, you boost your immune system, you detoxify all those neurotoxins out of your system, you can completely get rid of papillomavirus. Now, these are things that don't really mean it's a cure for a disease. Well, it does in the end, but it's actually a treatment that increases your overall performance, your body functionality, by absorbing the right nutrients, by providing enough oxygen, by building up that ATP production. We can treat and reverse so many chronic degenerative diseases, and that is one of those signs that shows glycogen, ATP production, really important. Now, there is so many different forms of pain and chronic degeneration that we can't go into all of them. Osteoarthritis, rheumatoid arthritis, lupus, multiple sclerosis, severe cardiac insufficiency, AIDS, cancer, stroke, benign prostatic. It's just, and that's all documented with studies, fractures, non-healing or failed unions, delayed unions in fractures of bones, urinary incontinence, chronic depression and mood disorders, wound, tremor, trauma, brain injuries, Alzheimer, Parkinsons. It's a lot, right? Now, that's always a problem, because when people come and say, is that device good for? And you say yes to everything, they become suspicious. Normally it's 1 pill per disease. And now we have 1 pill, 1 device that works for all of those diseases. So it's not really easy to sell that, but it actually works. And the key for that is always the same. And that's why I want to bring you back to that understanding, clearing out toxins, improving that cell membrane potential, clearing out those ion channels, letting nutrients, oxygen, and energy go in, and therefore having more ATP, builds up that enzyme shield, that protection around healthy cells, and you can get rid of virus, you can get rid of bacteria. And that's why Lyme patients who are in pain and agony and have muscle twitches, when they use PEMF, they just are, it's the biggest relief for them, because those neurotoxins from the bacteria are flushed out. It's a pain relief. PEMF therapy has shown to be effective at reducing pain, both in short term and in the long term. The ways in which PEMF therapy reduces pain include blocking the pain, nerve endings, decreased inflammation, increased cellular flexibility, softness. Again, if you all of a sudden can absorb magnesium into your system and all the cells relax and sleep better and function better, there's so many core functions that come out of that base element of clearing out the gunk that it makes total sense. And that's why using this for a lot of conditions has made this device quite famous. In many of the clinics that we've been, it's one of their top components in preparing the clients. Like I said, Dr. Rao has it in the dental department, in the massage department, in the treatment, in the hypothermia, and several of these devices in the infusion, in the IV department, because all of a sudden infusions are absorbed far better, and the result is a patient is not starved when they go into treatment. They're primed with all the minerals they need, and that makes a huge difference in the outcome of treatments. So knowing that and supplementing in the right way while you do the treatment really makes a massive difference. Now, the immune boosting effect is really significant, and you will find that when you have an oncoming flu, you feel tired, you feel exhausted, or there was a stressful week and a lot of things have gone wrong and your immune system is about to collapse. You really sit like you put your toothbrush into a stand and then it recharges due to those pulsing frequencies. Well, in the same way, you sit on that loop, put it on your belly or around your neck, and you recharge, and all of your systems come back to life. And that means you can really deal with disease far better. You can fend it off due to the increased ATP. You get rid of a flu far easier. So it is a very powerful thing. Plus, alkaline environment for optimal function is one of the effects that a lot of people think alkalinity has to do with what I eat. To a degree. There's people that eat just green kale, like in smoothies and whatever, and they're still top acidic. To turn your fermentation process into a proper ATP production, energy production, you need not only glucose or slow converting glucose, you need oxygen. It's like benzene, fuel that you have, and oxygen from your air filter burning at optimal heat. And that's why a lot of people, they are oxygen deficient. They can't absorb enough oxygen, and that leads to a wet burning, too much fuel, not enough oxygen, and that leads to high acidity, fermentation process, lactic acid buildup. And that's what we can prevent as soon as we flood the body with oxygen. Now, you can use ozone for that and hyperbaric oxygen, but that systemic recharge and energy that you feed into the cell to clear out the gunk doesn't happen with those other treatments. So it really is a very unique addition to any healing program. Inflammation. Well, we need to look at what causes inflammation, because it's an end result of something else. So viruses cause inflammation when they invade cells, use the cell, dock on with their RNA, release the RNA, and they use your amino acids to build a clone. Well, that is a highly inflammatory process in your body. That's why you are completely down when you have a flu or virus. That's why building up that, or killing off the virus and building up that immunity against viral infection really makes a massive difference, reduces inflammation. Bacteria overgrowth, we know that the inflammatory process from bacteria overgrowth in joints or in certain organs or in the teeth leads to massive inflammation. Again, we can drain that, eliminate that, kill off the virus, kill off bacteria, and eliminate that whole problem zone with PEMF. Diet, well, if you eat bad, that'll stay. There is no change. Sensitivities, if you eat foods that you are sensitive or allergic to, still the inflammation will not go down, because that's something you need to fix on that end. And DNA impairments as well. It's one of those problems that we have. If you have inherited from your parents a bad DNA and you cannot detoxify properly, you need to bypass those pathways. You need to find alternative ways to detoxify. And that is something that, your nutritionist, your naturopath, or your doctor can help you based on your DNA SNPs or impairments. It won't change with PEMF. We cannot alter our DNA, but we can help with the breakdown and by taking enough binders so that we don't stress our detox pathways too much. Heavy metal toxicity, huge burden for inflammation, gone. Deficiencies, absorption into cell, gone. Stress levels, I told you, it relaxes the body, it creates endorphins and serotonin and all those hormones that help you relax. So in that regard, a huge help. Trauma is actually something they use more and more, especially with patients that have that depression, chronic fatigue, and trauma. They use PEMF to release those emotions, like they use hypothermia, and the release is quite significant because those, how do you say that? It's like that accumulation of a thought that repeats and rotates and doesn't find a solution, materializes in our body. And that's how they often describe cancer too. There was a traumatic event, and then 5 years down the line you have, and there was a lot of work from Dr. Hammer that indicated trauma related to certain tumors in certain places, and they could locate them based on the scan of the brain. So there is a direct correlation. I'm not saying it's exclusively caused by trauma, but it's a factor that comes into play. So when you resolve that trauma with PEMF, you will realize that all of a sudden there is diseases that vanish out of the body. Just like when you fix a tooth, your bladder cancer can go away because one of your front teeth was infected. There is always a correlation, one leading to the other, and if we resolve one, the rest goes away. And parasites as well. There's actually anecdotal, I've never seen it myself. I never had parasites or don't know that I have. When people started to use high intensity PEMF on their belly or on their backside or kidneys, that worms on the toilet came out, long worms. Actually, I don't want to see it. It would give me nightmares, but certainly they do not like PEMF, and that's a well-known factor. So you can definitely have an improvement there too. Cancer, I told you, it's a cancer treatment in Europe, or part of the cancer treatment. And it has several functions. Number one, and I will show you that in a moment, the ionization, that huge amounts of negative ions that are flooded into a cancer conglomerate, into a tumor cell, is quite significant. And the permeability of those white blood cells, they need that. They cannot function. A white blood cell comes in an area where there is negative ions, and it goes whoop, 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 and does its work. And then it comes into an area where that ionization is positive. That's why we call, they use in dental situations left spinning or right spinning lactic acid. The right spinning is produced by the tumor, so when they use left spinning lactic acid to dissolve that. In the same way, if you have tumor tissue, you have a huge amount of positive ionization. So if we now bombard that with negative ions, we actually penetrate and our immune cells can go in without falling asleep. And they've tested that as well when they check in tumor tissue the penetration of white blood cell or the white blood cell activity. It has drastically increased with PEMF. So there's so many factors that are important. We also talked about it changes acidity, it increases your ability to sleep. PEMF is very important to find faster and deeper sleep. It helps you with deficiencies and infections, And this is a study that actually showed the effect of angiogenesis, which is your tumor is hungry and it sends interleukins and whatever that is, cytokines, to the nearest blood vessel and says, build me a supply. And it's like a constant calling. And then the blood vessel will build a tiny little vessel to the tumor and dogs on. And then the tumor gets food. And then that blood vessel gets bigger and bigger and more food comes through. The rest of the body starves. That's why you see advanced cancer patients losing weight. And the tumor keeps growing because all the food, all the glucose is absorbed into the tumor. So it's a parasite that takes up everything it can get. Now that process of angiogenesis is what we need to prevent. Now in that study it is described that the chemical reaction within the tumor creates a huge amount of positive ions that prevent the penetration of the cells, and therefore the ascending out of those interleukins to build new blood vessels is greatly increased. Now, as soon as you use PEMF, it increases the permeability of the cell membrane, tumor cell, and allows negative ions to migrate inside the cell and exert anti-tumor effects, and allows the immune system to actually deal and break down the tumor from the inside out. Fragments of damaged tumor cells resulting from direct pulsed electrocurrent application serve as antigens and stimulate the body's immune defenses. So when you pulse those high intensity waves through a tumor tissue, and there is little fragments that are splintering off, because cancer cells are very brittle, they are very flated. They are not like a normal cell with a strong membrane. They have like a patched membrane, and that is then dissolved, and that serves in your body as immunization. So your body learns who needs to be attacked, who needs to be addressed and eliminated. So a very, very powerful effect. Now, this video with Dr. Rao, PEMF destroys cancer cells, where he explained how they use high-intensity PEMF above 500 Gauss. And that was very important. Like, he has really powerful machines, like the big PMTs and Papimi, the one of the first spark chamber devices. And they do that on a daily basis. If patients come there, they are there for a week, they get 5 tokens, and every day they need to go down and pulse onto that tumor to actually break it down and allow all the other minerals, nutrients, vitamins, immune system, glucose, not glucose, we don't want that, they don't get glucose to eat at the clinic, but they get oxygen and everything into the tumor, and therefore the tumor weakens more and more and disintegrates. Prostate cancer, one of my top favorites. So many patients come, and because it's quite a common practice in Europe, they sit on the paddle, they sit on it and pulse directly into the prostate because it's only that far apart. They get up to 1,000, 2,000 Gauss with the Clinic Duo into that prostate. Now, as they do, they flush out the heavy metals. The prostate is like a sponge. And because you urinate through the kidney, chelation happens. All the urine transports heavy metals out. So that goes through that spongy prostate membrane. And therefore, there is always a high absorption of heavy metals. Through the urinary channel, which is in males not as intense as with females with that short urinary channel, the male, it's still bacteria overgrowth. So if you have a high protein diet, if you have not properly digested all the proteins, and there is a bacteria overgrowth in the bladder, well, then that goes through the prostate as well, which then leads to that bacteria and heavy metal overgrowth. We know if those two come together, like in a root canal filled tooth, the bacteria start breaking down that heavy metal and turn it into dimethyl mercury, dimethyl cadmium, dimethyl arsenic. And if you look that up, it actually shows how toxic that is. which means it's not only the thimerosal, which is from the bacteria, the toxin that they produce, it's actually in collaboration with heavy metals far worse. Now, Dr. Rao in Switzerland, and you realize I'm a fan of this doctor. He has given me more clarity than many, many other doctors together because of his scientific approach. When you look at the biopsies that they did, they cut out the prostate, the infected prostate, the tumorous tissue, and because they always want to get it all, they cut a little bit more of the healthy tissue as well. So in the laboratory, they did a test, toxicological and bacteria load test on both the healthy tissue and the cancerous tissue. And the cancerous tissue had up to 40,000 times, 20,000 times higher load of mercury toxicity, dimethylmercuries, and toxins, bacteria overgrowth as the healthy tissue. So what do we need to do? Get rid of the toxins and get rid of the bacteria load. 2 treatments: rectal ozone insufflations daily, 5 days a week, to boost the immune system to get rid of the bacteria overgrowth, and pulse into the lower diaphragm, into the sitting on the paddle, or even putting it up on top onto the grudge, so from the top and from the bottom, and pulse electromagnetic fields through that, shake loose all the toxins. Take very good binders, supplement with zinc, selenium, iodine, all of those things that your body needs or is deficient if you can test. And you will realize the swelling goes down and the problems of the prostate slowly disintegrate. And there is another added benefit. Every single patient that did that, and especially patients who had surgery on the prostate, who can have no longer an erection, they all reported back, and this is how we actually found out, that their libido and their virility has massively increased. So by using that pulse wave into that lower diaphragm, into those lower muscles, that is enhanced as well, which might come handy. Prostate swelling in cancer, there is different studies that all prove that I'm not inventing this. I'm not coming out of the blue sky with any claims. This is actually true. And only 7th of July, dramatic improvements after the treatment. On the July 25th, the reduction on the metastasis was more impressive. The patient had to return to the United States, where he intended to find a physician to continue the treatment. This is the problem when you go into a clinic and you have 2-3 weeks of treatments there. Everything starts to work, your tumors start to disintegrate, and then you go home. Well, rather invest into your own health at home and keep doing the treatment, keep at it, add good supplements, work with a good nutrition, build up your immunity, and then add those treatments on a regular basis. You'll save in the long run thousands of dollars and have the same outcome and the same results. Wound healing, it doesn't end. I could do 100 studies here. I'll just take the major ones. Dr. Finn Scott Andersen from Humlegarden in Denmark, he did a lot of studies. He did a lot of surgery, lumpectomy and for breast cancer, and they always checked the wound healing time with PEMF, without PEMF, with negative ionization, without. And he found that the healing results with high intensity PEMF was by far the best. No infection, no irritation, least scarring. The scar was very, very minimal, and the healing time was drastically expedited. Again, coming back to increased softness of the pliability of the membrane of the skin, plus a high level of ATP production, which helps always with every healing, plus the enzymes that make those cells healthy and active. Depression, I think I mentioned that before. Chronic, already bad. Incurable, even worse. Depression with a 67% or 72% success rate in reducing those factors. I think it's in the next page, HDSR 17 scores after 5 weeks. had come down into an impressive level from what they were before. So depression is very, very crucial when you have a heavy heart, when you don't really know how to continue. And let's face it, if you have a disease, it's exhausting. And if you have a disease over long periods of time and no matter what you do, nothing really works, well, that's frustrating. And that can easily lead into a depression. And then you have deficiencies, no matter what supplements you take, they don't work. And then you have high inflammation, you can't get down. And then that toxicity level is stagnant and stays. Well, then there is no future. Now, if you start doing the treatment regularly, you flush out more and more toxins, plus you release those serotonin and endorphins and all the happy hormones at the same time, it gives you hope. Also, having more energy, you know, when you have a week long of very exhaustive work, you get grumpy easy, you get exhausted easy, you're irritable, you can't focus and concentrate. That's what we all know, right? Now think about, you have that recharge plug and you can every evening recharge. In the morning you recharge before you go out and you don't go into those lows. Really an incredible treatment. And I've seen myself, people come to the clinic and it's already a joke that we do. Oh, grumpy, have a PMF. It actually works quite significant. Dr. Pollack has described 10 minutes of PMF treatment is changing people's mood and their ability to focus and concentrate and be with you significantly. And that's true, that's a fact. Osteoporosis, again, there are several studies that show that the electrical conductivity in the bone that intensifies that calcium buildup and the right transport is actually increased dramatically through PMF, but it needs to be done with a good supplementation program. It's not just the PMF that will do it. You also need to have a good supplementation regimen to make that work. Bone fractures, that's where it really is incredibly fast, even with horses. And you know, normally when a horse breaks a leg, they shoot it and that's it. Well, they've managed to heal bones where that electrical flow in the bone from bone A to bone B, where it's broken in between, is not sitting properly, and the electrical flow doesn't start rebuilding that scar tissue. So when you use PMF in that area, that is greatly enhanced. So we have from non-healing, non-unions, delayed unions to complete recovery with PMF, an incredible chance. And that's why it's used in high intensity sport. That's why it's used by top athletes, rugby players, soccer players, you know, people who have a lot of injuries, impact wounds, bruises, and all of that. They can't live without PMF because their healing time is so much faster. Also, if you do marathon or long bike rides and you have that strain on your knees, strain on your joints and hips, well, excessive sport is not really healthy. So that's where those devices make a massive difference, so that you're not an invalid at the end of your career, but actually can live a joyful and proper life. Incontinence, I said that before, there is a lot of clinics now starting, since those machines are safe and secure to be used in a clinic. They have chair after chair, and then the ladies come in, sit on that paddle or sit on the loop, and then they go duck, 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 and it's that muscle contraction that really builds up, takes the, the three reasons for incontinence are blockages, are inflammation of the urinary, is the descendant of the lower diaphragm, which then presses down onto. All of those things are activated, re-stimulated, and after 10 treatments, you will find that all of a sudden you don't need your diapers anymore. I think that's a really good thing. Multiple sclerosis, a 2-month double-blind placebo-controlled study with 30 people with multiple sclerosis was conducted using a PMF device. Participants were instructed to hold the applicator to their shoulder, back, and hip. And then they studied improvements. Notably, improvements was bladder control, hand function, cognitive function, fatigue levels. that we know before, and vision and muscular elasticity, spasticity. The effects are so multifaceted. Like I said, I have doctors that have that for their patients to treat eye diseases, glaucoma, cataracts. We have some that treat brain tumors and brain diseases. Others do for depression and Alzheimer and Parkinson's. There is actually no limit. And again, let me bring it back. The only thing PEMF does, it clears out the gunk. It cleans out your cell membrane, it increases the potential, it floods your body with negative ions and balances out those hot zones where there's too many positive ions, too much stale, stagnant, negative energy, even though it's positive. It's that reverse effect. And as soon as that happens, the body starts building up more energy, more ATP, starts to protect itself, builds those enzyme shields, and recovers. And that's what PEMF does and can do for you too. All right? And now let's move on to the next video where we discuss some of the technical terms and look at the different devices that are available and what they do and how you can use them best.